I'm Dr. Casey Jones, and ordinarily I love seeing all ages of patients from the time that it's their first visit at age 1 on up. But right now I completely understand if there are parents out there who don't want to take their little 1-year-old to the dentist because of COVID-19. So the most important thing during that visit is to try to prevent problems and to get the information to the parents. And so I thought today that I would try to give you that same information that I would give you in that appointment. And the only part that I won't get to do is to look in that little cutie's mouth and see those healthy, shiny teeth in there. So let me give you some pointers. Okay. So first of all, you have this little tiny baby that's born that hopefully does not have teeth when they're first born, but you have to start thinking about things right away because kids are not born with the type of bacteria that causes cavities. They get it from us. So if we are sharing utensils or we are tasting things for our child and giving that to them or letting our child stick their hands in our mouths, all those things can pass those germs on. So they are cavity-causing bacteria that can be passed from the caregiver to the child. So kind of from the time that they're about 0 to 2 years old, they can get the amount of bacteria that will initially put them at risk for having cavities. Because cavities are just a disease process. It's sort of like the tooth getting a cold. So cavity-causing bacteria makes holes in the teeth because it likes to eat sugar. And when it eats sugar, it produces acid. And that acid makes a hole in the tooth, and then the bacteria gets inside. And unfortunately, the tooth is the only thing in the body that can't repair itself. And so if there is a cavity that happens, then the dentist has to fix it. But a lot of people think, oh, it's no big deal, they're just baby teeth. But those baby teeth are gonna be in there, a lot of them, until that child is usually somewhere between 10 and 12 years old. And so we want to make sure that we can take care of them all along the way. So here is your little baby. What you can do is after you give formula or milk or breastfeed or whatever you're going to be doing, you can take either, just knocked over my other little guy here. All right, he'll take a rest. Okay, you can use a little finger brush and put it on there and basically brush the teeth. I will show you what that is. Also, you could just take a little piece of gauze or a washcloth and sort of just even wipe the gums off so that your child gets used to having something in his or her mouth. And then you also want to make sure that if you are giving your child a bottle, that you're not putting that child to bed with the bottle, because that can be something where even milk or formula has sugar in it, and the bacteria that causes the cavities is in that, and it will make cavities in that child's teeth if it stays on there all night. Okay, so that's the little baby. Then when it comes time for them to be more like 1 year old, usually around 6 months, but it can be earlier, it can be later, your child is going to start to get teeth. So with those teeth, you want to be sure that you are brushing the teeth as soon as they erupt. So as soon as you usually see the teeth on the little bottom part right here start to show up, you want to make sure you're taking that same washcloth, or you could take gauze, or like I said, that little finger brush, or even a spiffy. You could use that to clean the teeth. Once they're around 1 year old, they're going to have molars that have most likely started coming in the back. Again, it can be a little earlier, it can be a little later, but then you're going to want to use a small child-sized toothbrush to be able to get back there. And it's not always easy to get inside that little mouth, so there are a few tricks. So I'm going to kind of show you here what you could do. So I'll just put this guy there for a second. And so this guy, if you have something soft, like you could lay your child on a bed or on a couch, something like that, where they're lying on their back, that's often easier than to kind of sit on their side of their head, so you can look down into their mouth, and then they can open. You could even gently hold the hands if you're by yourself, and then you can use the toothbrush to brush any of those teeth that your child has. Okay, if you have a helper, the trick that you can do, I'll sit up here and kind of show you. Don't have your child sit on a table, but you're going to take your child and you're going to put one leg on each side so they're sort of hugging you. Then if you have someone to help you, you can sit knee to knee, You can be in 2 chairs together, however you want to do it, and you can then lay your child back onto that helper's lap. So now their head is going to be in your helper's lap, and you can gently hold the arms, keep your child safe. They're looking at you, so it's something that's comfortable. And this is a lot of times how I do that 1-year-old exam at the dental office. So I'm sitting here, but they're actually in your lap, so they're getting to be held by you. So you lean back, and then the helper, where's my toothbrush? The helper is going to take the toothbrush and be on this side, and then they'll be able to brush the teeth, okay? So the crazy thing is that you're going to need to help brush your child's teeth until they're like 8 years old, or can at least tie their shoes on their own. And the other thing that you need to start thinking about is usually around the time your child turns 2, the teeth are going to start touching together. And so you need to use something else to get in between the teeth, because we can see cavities start pretty early in the teeth when they're touching, because that cavity causing bacteria can get stuck in between and the toothbrush bristles can't reach there anymore. So then you're going to need to use floss. So you don't need to use that floss necessarily where the teeth aren't touching, but you could, because it's just good practice. But it's usually at least between the molars in the back by the time they're about 2 years old. And I always would refer to it as playing hide and seek for sugar bugs. So if you take that floss and every time you sort of feel a click where it gets caught in between the teeth, then I say that we found a sugar bug. Let's see. So the other thing to talk about is choices for snacks and for foods. So water's always going to be best. If you know that 4 grams equals 1 teaspoon of sugar, you can start looking at labels, and even juice that has no sugar added does have a lot of sugar in it. So there really is no reason for juice. It can be considered kind of like a dessert, but if given the opportunity for my kids to choose between a dessert or juice, usually they will choose to have the dessert. Other than that, things that are sticky, so it could even be pretzels or goldfish crackers that get stuck in the tops of the teeth, or gummies, or things that are going to stay in the teeth longer are going to be more likely to cause cavities. So good snacks are like apples get stuff unstuck, cheese. You can always watch the Oreo challenge and see the choices, but there's, carrots, nuts, things like that are going to be great choices for the teeth. And if your child is one that likes to snack a lot, they're going to be at higher risk, because if they have, let's say, 1 M&M every 10 minutes versus eating the whole bag at once, they're going to be at higher risk than the child who eats that whole bag at once, because the bacteria doesn't care how much sugar, it cares how often. So the consistency or the stickiness and the frequency, or how often you have sugar, are the 2 things that matter the most. All right, so I hope that you learned a little something, and I hope that you have a great day, and don't forget to smile.